As we've learned, arthritis can have quite an impact on someone's life. But why does it affect certain people, and how can they ease the pain? Here to talk about the causes and cures of arthritis is Assistant Professor of Medicine at Columbia University, Dr. Δημήτρης Pappas. Thank you for joining me.
Thank you for having me.
Can you please, for the audience, define what arthritis is and the different variations?
So arthritis means damage in the joints. And the most common type of arthritis is what we call osteoarthritis, or wear and tear arthritis, which is more common in people of an older age, sometimes in obese people or in athletes after damage in the joint. So this is damage in the joint. This is damage in the lining of the joint. There is no inflammation. And then we have other types.
There's no inflammation? Is it a different kind
we don't consider it traditional inflammatory arthritis the way we talk about inflammation when we refer to rheumatoid arthritis, for example.
So tell us about rheumatoid arthritis.
So rheumatoid arthritis is the most common of the inflammation-related arthritis. It affects 1 to 2% of people, of the general population.
1 to 2%?
Yes.
Wow.
And I think in total in the United States there are more than 1 million people suffering from
the
rheumatoid
CDC,
arthritis.
I think it was in 2007, said 1.5 million.
Exactly.
Yeah.
And
compared to what you said about 30 million for osteoarthritis.
So all kinds of arthritis at this moment may be affecting approximately 50 million of Americans.
Wow.
And is expected to increase. More than half of that is, of this population is suffering from osteoarthritis. Okay? As I said, approximately more than 1 million are suffering from rheumatoid arthritis. 1 to 2% of the population affects all ages. It may affect young kids, women.
Like our guest we just saw, she was diagnosed really young,
right,
like as a baby. Yeah.
Right. Women between the ages of 20 to 40 are more susceptible and are more common to be affected.
Interesting. So what does that actually mean? Like when you get a diagnosis, because you're a rheumatologist, when you get diagnosed with rheumatoid arthritis, what does that mean for the patient?
So patients usually suffer from joint pain. It may affect more commonly hands and feet, but every joint can be affected essentially. They wake up in the morning and they have morning stiffness. They cannot use their hands. It's very painful to walk, to get out of the bed. And in more severe forms, they may have fever, they may have fatigue, they may lose weight, their appetite may decrease. Some patients are really miserable.
And it's a lifelong disease. Once you're diagnosed, I mean,
yes.
Any
so
autoimmune
patients. So what happens is the immune system that is there to defend us from, from bacteria or from cancers, for some reason, is attacking our joints.
Right.
The immune system thinks that there is something foreign in the joints, to put it in simple terms. And we can only quiet this process. We can start medications to quiet the immune system. And in most of the cases, more than 90% of the cases, patients will have to stay on these medications for the rest of their lives.
Okay, and these medications are no joke. I mean, these are very serious, intense medications that have like side effects, like the immune suppressants.
Yes, but I would focus more on the fact that they're very serious, potent medications
because they help.
That can make people reach what we call remission, which means no pain, no disability, no damage in the joints, a fully functional life. People with rheumatoid arthritis, you cannot differentiate people with rheumatoid arthritis today from people without rheumatoid arthritis. The only difference is that they take their medications and they have to see a rheumatologist.
So basically you have a really powerful arsenal of medications at your disposal now. So let me ask you what you think about the things you can do yourself besides medications, like exercise. Like how do you feel about, do you recommend your patients exercise when they're diagnosed?
We usually recommend whatever a person without rheumatoid arthritis should do: a healthy lifestyle, exercise, a healthy diet. That's more relevant nowadays because what we know is that patients with rheumatoid arthritis are at higher risk for cardiovascular disease, heart attacks, strokes, etc.
Right.
So
who would have thought that rheumatoid arthritis would have an increased risk of cardiovascular disease? I was surprised when I read that in the literature.
It was surprising, and it accounts actually for most of the premature deaths in this population. And it seems that the inflammation, the same inflammation process that drives the joint damage may be the reason why we have vessel damage and heart damage But this is something
Same in
that
the
is under
heart.
investigation, yeah.
Fascinating. So do you think there's anything that we can do to, is there anything we can do to prevent it from happening or to slow down the progression?
Of rheumatoid arthritis, yes, there's a lot we can do to slow down the progression. It's very important that patients are referred to a rheumatologist as soon as possible. There is this concept of the window of opportunity. The earlier the patient is being seen by a rheumatologist, the earlier the patient starts a medication, then the less damage will accumulate. And then, as I said, healthy lifestyle to decrease the possibility of what we call comorbidities, cardiovascular disease and other
Muscle wasting and all that.
Yeah, exactly.
Thank you so much, Dr. Pappas. Very good, very interesting information.